everyone, so welcome back. This video is going to be about my recent allergy test that I got done. So I'm going to briefly explain why I had to get the allergy test done and why it took me 11 months to get it done. So this year, back in January, when I was at work, I suddenly got a swollen eye, and then I started having difficulty breathing. I started wheezing. At first, I thought I was just getting a cold or something, because at first it started with sneezing, and then I started getting those symptoms, and then I started getting really itchy all over my arms because I had hives everywhere, which I was wearing long sleeves, so I didn't know until I got to the ER and took the long sleeve off, wherein it was all red, covered in hives. So I drove myself to the ER, which I probably shouldn't have done, but right when I got into the ER, they took me in right away. They checked my vitals and everything, and then they admitted me into the room. So they just say it was like an allergy reaction, and then they gave me the epi shot, but the one they have there, and then they injected me with Benadryl. And when they injected me with Benadryl, my reading stopped. So I was really scared. I thought that was it. I was gonna die. I wasn't gonna make it. And then it was really scary, and I wouldn't wish that on anyone. And then it's funny because I was talking to someone at work that even had the same thing happened to her. She said it was because the Benadryl they give you is concentrated. So, but I don't get why they would use Benadryl if it's risky, if your breathing is gonna stop. Or they say it's like the medicine working, but your breathing should not stop at that point. Like, they had to give me oxygen. And the funny thing was, it wasn't even on my ER report saying that, we called the doctor because she couldn't breathe, we had to put oxygen on her. It's kind of fishy because none of that was on the report. Anyway, so I went back to my primary doctor and told him that, I was in the ER, I had anaphylaxis, and I would like to see an allergy specialist. And he didn't want to give me the referral to go see an allergy specialist. So all the way in September, I had to go back because I wasn't feeling that well, and I had seasonal allergy symptoms. So I told him, I was like, can I see an allergy specialist now? I have allergies. So he finally gave me a referral, and then I went to the allergies, to their office, the allergy specialist, in October, beginning of October, I believe. So I told him all the symptoms and everything. So he requested that I get a blood test done, and I get the allergy test done, because I didn't know if it was environmental, dust, or if it was food that I ate. So he was gonna test me for both, and then he did the blood test to make sure I don't have any immune disease or anything like that is causing all of that symptoms. And thankfully all of that came out clear. I don't have any immune disorder or anything, which I'm really, really thankful and blessed for. So if you saw my depot shot video, you noticed me talking about how because of the shot I wasn't feeling that well. And if you follow me on social media, you saw me post about the really bad allergies that I really had. So you know what I'm talking about. So what happened when I went to the checkup for my allergy, he checked inside my nose, and my nails are the passages inside were even swollen, because I guess I got a sinus infection, because I did get my throat was swollen, and then my doctor gave me an antibiotic, which was wrong because I went to the ER again after that, before the allergy thing, and then they just told me I had a sinus infection pretty much, and they basically said your doctor shouldn't have given you that antibiotics. And so anyways, the antibiotics helped just a little bit, the swelling went down, but it still felt like I couldn't, it was blocked. There's just so much mucus coming down, it felt so blocked. So my allergist right away, when he checked inside my nose, right away he prescribed me a nasal spray. So after using that and the Zyrtec he prescribed me, I've been feeling a lot better than I was a couple months ago. So I can say that I am doing a little better. So later on after this video, you'll see me before going to the test, and then pictures of how the test looks after. So basically, when I went in, it does not take that long. I was really scared because I thought I was gonna go into anaphylactic shock, because it is a side effect. Because they're literally putting the thing you're allergic to on your back, even if it's a small amount. So I was really scared and nervous, but I made it. So first thing, the nurse came in and then they wipe your back with, I guess, alcohol. It was just like a swab, and she wiped it, and then they tested me for 91 things. So the thing, it wasn't like a needle, but it was like plastic, but it had like a little thing that it can poke you with, and I guess it has like a little liquid of the allergen. So like one by one she poked me with it, and then I was really scared, so my heart started beating, and I was like, is it normal to feel lightheaded? She's like, no, so I'm gonna have you sit up after. 91 pricks after. She set a timer for 15 minutes, and then right away, like, whatever I was allergic to, it started showing, because my back started getting red in those spots, and as you'll see in the picture. And then for most of the things, I started getting hives. And it's weird because, like, the bigger hives were mostly for like plants and trees, and which I was really surprised for. I was expecting like either to be dust mite, or like, I knew it had to do with pollen, because I feel like every time the weather changes is when I usually get this allergy symptoms. So I was mostly right, because it was most of the things I was really allergic to were trees, grass, weeds, and stuff like that. And then for food, I had some food allergies, but it wasn't as much, like, it wasn't as severe as like to the pollen and all of that. And I wasn't allergic to dust mites, so I was wrong on that. But now that I know what I'm allergic to, I can take better care of myself, avoid the things that I'm allergic to, and hopefully the medicines help me as well, and that I get better. But the allergy test was not as bad as I thought it would be. It's not as bad as people think it is. Yes, it's like you're getting kind of, they I don't know why they say it's like a needle, but it didn't really feel like a needle, but you do feel the little pokes. But yeah, so the prick test is not a needle. It's just like a little plastic applicator with a little liquid that, like, with the thing that pokes and liquid comes out. But it wasn't as bad, but my back did look pretty bad. The only downside of it is that it got really itchy, but the nurse did put a cream after, which really helped. And I do have a picture that I've included. So after I think, I want to say 1 hour, like, there was like nothing there already. 1 or 2 hours, but the picture was taken 3.5 hours after. And then there was like a little bit of one of the trees that gave me a really huge hive. That was the only one that was there, but you could barely see it. So I'm really thankful that everything went well, and now I know what I'm allergic to, and I'm hoping that I could get tested again in a couple years maybe to see if I'm still allergic to it, because your body changes. You're gonna be allergic to one thing one day and then another day. I just wouldn't wish anyone to go through like what I've been going through. This year has been really tough with the allergies and everything. And then for people who have really bad allergies, they do need to carry an EpiPen with them in case you do get that severe allergy, so you can stab yourself with the EpiPen, and that can save your life. It basically saved my life when I went to the ER, because that's what they inject you with, and then they inject you with steroids as well. But yeah, hope this kind of helped you, and hopefully this gave you a little more information about me and what I've been going through the past couple months and the whole year, and hope you enjoy. Hi everyone, so I have my allergy test in about an hour, and I'm a little nervous and scared because I don't know what's gonna happen, but stay tuned.